Hello, everybody. My name is Patrice Schneider. I'm the nurse practitioner at family practice with Nova Medical and Cubana Med Aesthetics. I am partnering with Nova Medical for GLP-1 and agonist weight loss medications, so on and so forth, actually. So today we will be showing you how to reconstitute your GLP-1 vial. So as you see here, you will receive in the mail or special delivery, if you're close by to us, your GLP-1 vial, which will be in a box in this cute little container, and it will be in a powder form. Once we reconstitute it, or what that means is adding a watery solution to that to make it a liquid, then it will be ready and prepared enough for your injection. So you will receive not only the vial of medication, you will have a bottle of reconstitution solution. You will receive insulin, we call them insulin syringes, but they're syringes not only for insulin, but other subcutaneous or injections that require small depth into the abdomen or in the arms. You will also receive alcohol pads so that everything can remain as stable and as sterile and clean as possible. So, all right, so you receive your vial. You can flip off the top. It's still clean, obviously. Obviously, I washed my hands before doing any of this. So universal precautions. Wash your hands before you do any of this. So opening it up. I'm going to open up the vial, which I have one nicely opened here. I will take an alcohol swab, open it up and put it to the side. Also, the syringes are 1 ml and they go up to 100 units. That's why they're called insulin syringes. Take off this little protective cap at the end and just push forward just to make sure all the air is out of the syringe. And you can place that down. What we're going to do is today we're going to, just for example, we are going to reconstitute this small little vial with 2 cc's or 2 mLs of water for this particular patient. Okay, so I have my syringe, my alcohol, my medication, and I have my solution. Take your alcohol swab, and you're just going to clean the tops of both. All right, put that aside. Since this is a 1 ml, you can see that 1 ml syringe, we are going to pull up this full syringe of water. Put it in, turn it upside down, and we're just going to slowly pull back on our syringe here. And see, sometimes we pull back too far. All right. So we have one, and you can see there's no air bubbles in there, which is great. But we're going to check. We had that little one there, and we're going to go back in. It's this very small needle, so sometimes it takes a while for the solution to be pulled through. There we go. Again, a little bit, and then what we're going to do is we're going to put it right into our syringe, and we're going to just press the solution in. As you can see, it's starting to turn into a liquid. And then we're going to do that one more time. And this is for this particular patient. Your instructions for yourself will be written out in detail, stating exactly how much solution you will need to pull from this vial and to actually place into your medication vial. And as you can see, it's just taking a little bit of time. And I'm just going to push a little out. Here again. And now I'm just going to push it in. And I'm meeting a little resistance, so I'm going to pull back out. And these needles are very, very, very fragile, so you will get extra syringes. Because they can break easily. And now we have 2 mLs of solution in here. And as you can see, these needles are very fragile. They bend easily. So I would suggest using 1 needle to reconstitute and then choosing another needle to actually inject yourself. Roll it around. You don't want to be too aggressive with your mixing here, because you don't want to mess up the molecules of the medication. And as you can see, it is completely reconstituted, and it is now ready for administration. And like I said, you will follow the instructions of your provider based upon how much solution needs to go into the medication vial, and then how many cc's or mLs you would need to actually pull up for each of your dose. Thank you so much, and have a great day, and I hope to talk to you soon.